The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Welcome back to Daytime, everyone. Oftentimes you'll hear people over 40 say, I really don't feel my age. I just don't recognize myself in the mirror. Now it's easy to look as young as you feel. As we age, our skin loses density and gravity takes its toll. But rather than have surgery, why not try an injectable filler? Joining us now is Dr. Michael Jasin, a certified facial plastic surgeon and owner of the Jasin Facial Rejuvenation Institute. Welcome to Daytime.
Thank you.
Let's talk about these injectable fillers. We're hearing all kinds of news about them. They're becoming increasingly popular. What are they?
Well, they're actually part of the new wave of non-surgical options we have available for our patients who want to look better and younger, but don't want to have surgery. Historically, over the years, all we really had in the United States filler market was collagen,
right,
which needed to be repeated every 2 or 3 months. So it became not only cost-effective for people to do on a long-term basis. Now we have an influx of new filler materials that are more versatile and longer-lasting. So now it's more practical and cost-effective for patients to choose these non-surgical options.
Something that happens to most people when they hit a certain age, they get the parentheses here. And that can really give away your age. You may not feel it, but there you have it. It's right there in the middle of your face. You have a solution for that, right?
Right, and you raised a good point, because people say in the office when they come in for consultation, I want to look as good as I feel. Mm-hmm. They don't necessarily want to look 20 years younger, but they want to feel commensurate with the way they feel. And the parentheses are part of that. That's due to fat pads in the cheek dropping down and making this hollow below the eyelids, and then we get accentuation of these folds. So the fillers are there to fill out those sorts of things. And historically, that's something that we've done with fillers. And the nice thing is now we have various fillers that we can more flexibility with to do other things to revolumize the face and recontour the face. So rather than just chasing lines and wrinkles like we always did with collagen, now we're trying to reshape the face and restore volume and contour that's been lost due to these shifts in volume that we experience over time.
And we just saw the before and after, and that was pretty dramatic. I mean, it doesn't take a lot of time, does it? Somebody could get this done on their lunch break?
Oh, easily. It just takes minutes for most people.
Wonderful. Okay, now there's a difference between the fillers, and they're used for different purposes, right? We've talked about the parentheses here, but you have different places in the face that you can use them, right?
Right, that's correct. And one of the most common fillers that we have is Restylane. And Restylane, Juvederm, and Perlane are made of hyaluronic acid, which is a naturally occurring substance we have in our own tissues. Those products tend to last about 6 months or more in duration.
That's promising.
Another product called Radiesse is made of calcium hydroxylapatite, which is a mineral that we naturally have in our bones and teeth, yet when we inject it into the face, it's soft and pliable.
Well, tell us about the woman we're looking at. What have you done with her, and what have you used on her?
Well, we've injected Radiesse in various areas. We've injected her cheeks and mid-face. We've injected the brows, between the brows, the nose, and the parentheses, if you will, and the cheek.
And she didn't have any downtime?
Very little to none, actually, and that's the nice thing about the fillers. The way we apply them now is we can get some very dramatic results, and in some ways do things we can't do with surgery.
Now let's talk about this woman. That's pretty dramatic, and that was just through fillers?
Well, she had a small incision lift and a little bit of filling around the mouth, and she lived in Oregon. We had talked about doing the cheek augmentation with the injectable, but we didn't do it initially. She thought about it for a period of months and came back later, had the cheeks injected, and you could see the nice improvement in the contour of the cheek that we really couldn't achieve with surgery alone.
Okay, and finally you have the invisible touch technique that you really like to use.
Well, this is an innovation that I've developed as far as how we inject fillers for the mid-face and jawline, and I must admit that it's really revolutionized how we treat those areas. The technique is done with an injection through the inside of the mouth. We can actually just apply a topical anesthetic to the inside of the upper lip. We mix a small amount of lidocaine, which is a local anesthetic, with the filler, which is typically Radiesse because of the added structure and support. And we inject it right on top of the bone in small amounts. So we have these little balls of material that are shaped and molded to contour the face rather than just superficially injecting material into the skin.
Isn't that wonderful?
And the beauty of that is that there's very little to no swelling and bruising, so people can walk out of the office without the telltale sign of having an injectable done.
We like the sound of that. Dr. Michael Jasin, thank you very much for joining us today.
Thank you. Appreciate it.
For more information on the Jasin Facial Rejuvenation Institute, call 888-815-3223 or log on to jasonfacial.com.